Okay, there we go. And so as we have these discussions, remind yourself, if you're starting to get a little grouchy, that I don't make the rules. I just work here. The law is the law is the law. And so you don't get to, in your practice at least, and when you're actually dealing with patients, you don't get to be the decision maker on what's really right and wrong according to the law. And some of the more sensitive topics in recent years are things like wearing a mask when there's a mask mandate. You have to do it. If the law says you have to do it, you have to do it. If you don't do it, there are consequences associated with that. I could point to numerous cases where people end up losing their licenses because they weren't smart enough to just follow the dang rules. Now, I will show you a case, as I just got it, actually, the university president sent it to me a few weeks ago, and it's in regards to a former UWS student, and it's a fantastic, it's out of Alaska, and the court did such a good job at breaking down some of these issues. And one of those issues is, well, he didn't want to wear a mask because evidence didn't really support what was currently being said by the rule makers. And now we're years later, and we see that his position was actually right. That the type of masks that they were recommending weren't really all that effective in doing what they said they were going to do. And what the important part about that is that actually that doesn't matter, because the rule was in place. And if the rule's in place and you don't follow it, you will be punished. And you can't say I shouldn't be punished because the rule was there. And I know that sounds very authoritarian, but here's the deal. The United States and Canada are democracies. The systems that govern specific professions are not. These are authoritarian dictatorships. It's kind of like my class, or any class. I'm in charge. I get to decide what's taught. You don't get to decide what's taught. You do get to submit reviews at the end of the semester where for the four of you who will do that, you'll have very strong opinions about stuff. And that does a lot of times factor into how I kind of approach certain things. But that's not a democracy, especially since your name's not attached to it. So, there's no heads on pikes at the end there. So that way you're free to actually express yourselves, which is really important for students to be able to do. So as we discuss things in here, just remember, I'm not sitting here telling you that if you don't believe in vaccines, that you're a monster. I'm not saying that. I'm saying that if you have different theories and ideas about vaccinations, and then you go and you tell that to a patient in an exam room, you are not a good doctor, because that is outside the scope of your profession. That's outside the scope of your practice, and there's certain things you're not allowed to advocate for like that. It's the same way if I went to my dentist and he saw a mole on my cheek and going, "Oh, you have cancer." He's not a dermatologist. Even my podiatrist, that'd be outside the scope of her practice. You have to follow the rules of what you're allowed to do. Even though, and this, you've been through 8 full quarters now of this, you have a very good understanding of a lot of different parts of the body. But that doesn't mean in every situation you're allowed to weigh in on those things with your patients. It all depends on the licensing body. So wherever you end up, Oregon is very big. It is very broad, expansive view of what you're allowed to do in compared to other jurisdictions. So wherever you're going to enter practice, whether it's in Oregon or in Alberta or in Louisiana or in Texas, you need to look to specific guidelines of what you're allowed to do. And if you go outside of that, you'll get punished, and there's no recourse. There's no argument. Ignorance is not a defense in these cases. And so, all right, that's enough of the kind of the general philosophizing. Let's take a look at the chat real quick. Okay. Someone said republic. So, oh, you mean about the difference between a democracy and a republic? Yeah, a democracy and republic, how they're both. A republic is like an engine in a car. And democracy is the gasoline that makes it work. You have to have both. You can have a republic that is not a democracy. You look at the Roman Republic. That wasn't necessarily democracy. It had representatives, which is what a republic is, that came in and made decisions. So very wealthy people got together and said, we're in charge. While in the United States, that's actually still what happens. But we have the guys that you can come in and vote. And so I vote, you can vote. And so we are a democracy and a republic. And so, yeah, political theory is interesting, while politics is just, yuck. So let's share my screen and we will go through this material. So how do we share screen? My desktop, share. Cool. All right. So let's jump through some materials. Raise your hands if you have questions. Oh, I gotta minimize this. See, I can't ever see it when I do that. Minimize that. Okay. All right. So office hours. If you need me, send me an email. We'll set something up. We'll figure it out. If I'm in trial, I'll set up time later the day or earlier in the day to make that work. But sometimes these hearings just pop up. And so I can't just put anything straight out saying, hey, I'm going to be available on Wednesdays at 4 o'clock. Another thing to remember is I am a lawyer. I'm not your lawyer. So if you have specific legal questions about you, don't do it. People, I always get someone that says, hey, I have a child custody arrangement I'm not in favor of. Well, then you shouldn't have gotten divorced. I mean, if you don't want to have to submit to custody, then I mean, there's only another way to get around that. So don't ask me those questions. It's not appropriate for me to do that. I can refer you to other people saying, hey, I do have a custody issue. Can you send me to someone in Oregon that you trust? Yeah, I'll do that. That's cool. But remember, this is a teacher-student relationship. I can't weigh in on your individual stuff. However, if time comes in, hey, I'm about to get employed at this clinic. They sent me this contract. I have a concern about this non-compete agreement. Can you tell me a little bit about that? Yeah, absolutely. You free reign on that for the rest of your careers. Reach out to me with a one-off question like that. I will definitely help you out. And you don't have to worry about getting a nice little bill from me. And I use memes, so get used to this. And this is how legal questions generally go. Someone says, hey, is it legal? And the answer is, it depends. There's variations to everything, and every legal question should be answered with, it depends. No lawyer should be able to answer your question just off the cuff, because it has to be more nuanced. Every situation is different. That's why I can't just have someone come in that's going to say, hey, I want to serve my husband with divorce papers. I can't just give him a form. There's much more I need to know. Another thing is, I'm not teaching you a law course as if you were law students. I'm teaching you as chiropractic students to make you think as a lawyer thinks. Because if you think like a lawyer thinks in a legal setting, one, it'll save you money. You won't have to go to a lawyer for every single little question you have. You'll be able to kind of figure it out. And secondarily to that, it's just kind of a good practice to start thinking in a critical manner about everything in that it depends situation. Not every answer should have a direct line. There should be tangents that you need to consider. And we already talked about this. Where do ethics come from? And where it's centered is in the concept of right and wrong. And your ethics will be determined by a particular governing body. So in healthcare, sometimes these memberships are voluntary. There are associations that are voluntary that you pay a due and they give you some kind of benefit, whether it be networking or forms or services, but they have their own rules to retain membership in. So if I'm an honorary member of the Starfleet Academy, and it comes out that I'm secretly, sympathetic to the Klingon cause, they could kick me out, and there's nothing I could do about that. But I'm a member of a mandatory society, so as a member of the Bar Association, I have to pay dues and insurance to a certain entity, and if I don't, I'm out, and I have to follow their rules. you will be subject to the, in Oregon, it's the Board of Chiropractic Examiners. This chiropractic board sets the rules, and it's their rules, not yours, that matter when it comes to maintaining the minimum level of care. And so they will set the minimum levels, and then you can build off of that. And that's how the United States government's set up, supposedly. It's a federal system. So the US government sets the baseline. You cannot discriminate against people who are, they'll pass a law saying you can't discriminate based on gender. That's the minimum. Now, a state can pass a law that adds to those protections, but not subtracts. And so they can pass a law saying, okay, well, we won't discriminate based on gender or on eye color. They can do that, but they can't remove from that saying, okay, well, the government says we can't discriminate based on gender. Well, we're going to pass a law saying, unless we think you're icky, which they try to do, and then they get shot down in the higher courts. And so same thing with these rules. You can have higher standards of care than what's required of you, and you should. Where do ethics go? So your medical ethics are closely related to law because they're written down. And being able to engage in an ethical practice means you're able to recognize that a situation is difficult, and then be able to approach them rationally and principled, not emotionally. These are terms, these will be on the quiz, that you need to understand. So first of all, autonomy, the right to choose for yourself. You have to respect your patient's right to choose. And part of that is not just letting them choose for themselves, is making sure they're well informed. And we'll talk about this concept called informed consent. I'm sure you've covered it already several times, but from a legal standpoint, you need to know at least the trigger words there. Beneficence means just always do good. It's the Pollyanna, mindset. You always have to be doing things to lead to a better outcome. Non-maleficence, it's that do no harm. Don't do anything that's going to hurt anyone. Confidentiality, one, there's HIPAA. We'll have a whole lesson on just HIPAA. I spelled it wrong. Oh my gosh. Sorry about that. There's 2 A's, 1 P. And so HIPAA is a major privacy act, and it's getting more important as everything is now digital. And if you get hacked, you could absolutely be liable if you've not taken at least reasonable precautions. So if someone hacks your system and ransoms it, and you don't pay a reasonable ransom, you could actually be liable for that leak. And so we'll talk about that in great detail, but it goes beyond HIPAA. Confidentiality extends in a lot of different nuanced ways that we'll cover in that lesson as well. Justice, that's just, to be fair. That really comes into play with things like billing practices. Sometimes you need that money. Every time you need that money. But there's more to it than we can just cover in this brief little part of this lecture, but we'll talk about that during insurance law. Veracity is about being honest and truthful. Lies have consequences in general life. They have big consequences in your professional life. And then a fiduciary duty, and that's always acting in the best interest of others. I'm the fiduciary in a lot of senses. When I draft wills, or I become the executor of a will, I have a fiduciary duty to act in the best interest of my client, which is the will. I know, my client who wrote the will is dead, but that's my duty is not to them. It's to the will. It's to act according to the best interest of the will. And so I know the kids may need that trust money, but if the will does not dictate that, I have to, even though ethics would say, yeah, they really need that money, or they need this thing happening, I have to act in the best interest of my client. You have to act in the best interest of your patient. So if the best interest of your patient is to send them to another doctor that you feel is more qualified to do a specific thing or treat a specific thing, you have a duty to transfer that patient. And so these are all concepts we'll just kind of cover in every lesson in some degree. Now, remember, your ethics equal your choices. You can't be unethical unless a decision is made. And sometimes not acting is a decision. To not act is unethical. A good example of that is that in the United States in general, you have no duty to act. You could be taking a stroll by the pond and you could see a 2-year-old wander out on the dock and fall in the water and start drowning. And you have no legal obligation to jump in and help that kid. In general, there are some nuances to that, but in general, you can't be held criminally responsible for not endangering yourself. Is it ethical to let a 2-year-old drown? No, it's not ethical. Is it legal? Yeah, but there is a choice there, and so you need to recognize that even inaction is a choice. And so there are situations when a patient may ask you about something and your silence is an answer, and that can be held against you. So can an intentionally bad choice result in intended good outcomes? Yeah, absolutely. Here's the classic example they use in every ethics discussion from when you're 5 on. If my pregnant wife, when she was pregnant, came to me saying, "Hey, honey, do I look skinny?" You know the answer to that question, right? Yeah. She looks, yes. Does she actually look skinny? No. No person with a football in their uterus should look skinny. They look healthy. They look like you should, carrying and manufacturing a freaking human being. And so looking skinny shouldn't be part of the equation. It is a completely different level of amazingness they look. But so there, break that down to a simple question is, yes, you can tell a lie for a good reason. Is it ethical? Yeah. And so, in some situations, I give those examples, you do have to blow up a bridge to build a nicer one. But can a healthcare provider justify doing the same thing? And the example I like to use is out of popular culture, and it's the TV show House. We have this Sherlock Holmes-based character played by Hugh Laurie, who very good show, very, very good nuances to this. But in any real world situation, that show would have ended after the 2nd episode because he would have lost his license. And so in general, in an infinite universe, could there be a situation? Yes. But in general, no, you can't justify doing harm. Aside from like surgeons, you have to cut into someone to get to the organ. Okay, well, yeah, that is harm. But in your instance, in your scope of practice, I have a hard time coming up with an example other than, they're going to be a little sore maybe. And is soreness harm? Well, okay, yeah, it hurts. But aside from that, you can't really justify actually causing physical irregularities in someone's body. And sometimes that involves, taking a good medical history, making sure someone doesn't have a cracked vertebra in their neck before performing an adjustment. There are multiple cases every year of chiropractors performing neck adjustments on people they ought not to, that result in things like a hemorrhagic stroke. And so you have to ask those lawyer-based questions of all the aspects of this person's healthcare history to make sure this is the appropriate level of care. So a general question is, what is, let's say, science? And by science, I mean the science of everything, healthcare, all encompassing. And this is a very confusing topic for a lot of people because people don't know what the heck science is. So a case study I like to bring up is Dr. Linus Pauling, a brilliant, truly brilliant chemist, won a Nobel Prize. I think he actually won the Nobel Prize for peace. But was a very brilliant man back in the 30s, 40s, 50s, 60s, and revolutionized our understanding of chemical bonds. Really, we would not be where we are today without him. Now, that being said, Dr. Pauling published several books in the 60s about using megadose vitamin C to prolong life, to cure polio. Couple issues with that. One, megadose vitamin C doesn't do any of those things. In fact, we know that megadose vitamin C just makes you pee. Megadose vitamin C urine. And so there was no foundation whatsoever, no reproducible evidence that Dr. Pauling could produce that supported his claim. So a lot of people would buy his books and say, well, he lived to be 96. Obviously, he's right. And they'd see these anecdotal little pieces of evidence and come to the wrong conclusion. And so this was a highly unethical thing to do by Dr. Pauling because people assumed that a Nobel Prize winning scientist must know what he or she are talking about. therefore they must be right. And so we can't just sit there and watch Bill Nye go on TV and say something and be like, well, Bill Nye is a trustworthy scientist, therefore it's true. In general, Bill Nye does a good job because he brings the facts, he brings the science. He goes, this is my opinion, but here's the evidence, here's the reproducible reason I'm telling you this. And he points to the science, but he is not the science. And Dr. Pauling, people assumed he was the science. And so it's not a person, it's not an opinion, it's not a book, it's not an article. One of my favorite things to point to is that people say, well, climate change isn't real. There was in the 70s, they used to say that the globe was cooling. And I go, well, who said that? Point to your source. Instead of being a goober, tell me where you're actually getting this. And they don't know, obviously. And I go, okay, well, I'll tell you where that came from. It came from a series of a couple of articles out of the illustrious scientific publication of Newsweek. So no, science never said that, but people like to rely on that junk. So science is not just an article. When I'm in my garden and I bust out the Roundup to take out some weeds, and my neighbor goes, oh my gosh, I saw an article. No, there is no actual reproducible evidence that links glyphosate to cancer. There is some anecdotal evidence, and some juries were convinced by that. But in the actual science sense, there is no reproducible study that links the two, which is a very interesting thing for a lot of people to hear. And so I'm not saying glyphosate doesn't cause cancer. I'm just saying there is no science that supports that claim yet. So that's another scary part. And so I haven't actually used Roundup in my garden. That's just an example I use. And so you got to remember, it's not just, I have an article. An article is not science. Even one scientific paper is not the science. You need the reproducible aspect of it. So it's a process of ideas. It's an investigation, reporting, and continued reporting. This was a thing that happened in COVID that still cheesed off a lot of people, is that this process was very much, according to an emergency situation, was rushed along, for better or for worse, whatever your opinion may be on that. And so we see the flaws and the hazards and the drawbacks. But the thing that I need to hammer into to everyone that I have this discussion with is that the universe there's no contract with the universe to make sense to you. If you don't get it, you don't get it, boo-hoo, too bad. But just because you don't understand it doesn't mean it was not true. Just because you don't agree, or you can't figure out how the ancient Egyptians built pyramids, doesn't mean it was freaking aliens. Okay. And there's a whole other ethical discussion about that with Mr. Graham Hancock. And I love those rabbit holes. But just because you don't get it doesn't mean it wasn't aliens. There's your general lesson right there. So I use this picture of these, when I studied Constitution law, the Constitution is like 20 something pages long. It is not a big document. Now, the book that I studied the Constitution out of in law school was about 1,600 pages long. And then I had to buy a supplement that was about 2,000 pages long to explain the book that explains the document. And so it is deep. It is deep. And so if you appreciate the deepness, then I think you're going to be okay. So I'm going to take a break here in about 5 minutes and take that attendance real quick. So let's talk about the doctor-patient relationship. And so this is the basis for where your obligations stem from, and from which you, the provider, will be expected to adhere to. And so while that relationship says it's a two-way thing, it really is a one-way street. This is a unilateral contract almost, where you are the sophisticated party. So everything bad that could happen is going to be put on you. And so formation, and this is where the gist of this part of the lesson I want to hammer in here is that you need to be super duper extra careful with how you talk to people and how you engage with people. And so, like, I'm wearing my sweater right now that says I went to law school. And so when people see me, if I walk out onto Main Street here outside my office and someone walks past me, they'll see me and they'll instantly, oh, lawyer. If I wasn't wearing this, they go, oh, tall, weird, blonde guy that we should avoid. Different things happen. So, and this is going to, if this hasn't happened to you already, it will happen to you. When people find out you're a doctor, the way they act around you will change. And so if I go to my dentist doesn't know I'm a lawyer because my last 3 dentists did, and it changes how they treat me. They won't tell me I need to floss here or there. They won't do these things because they're scared, whether consciously or unconsciously, of Mr. Lawyer who might sue them, which I will. If you mess up, I'll sue you. You should. Someone messes up, that's just the way things should work. And so with you, if you're playing in a rec league softball game and someone's running the bases and they trip and roll their ankle, you're going to feel inclined to run out there and help. And I'm telling you to not do that. If you're sitting on an airplane and someone says, is there a doctor on board? Keep your butt in your seat. Unless that person is dying, they don't actually need you, because for a lot of reasons. One, you're not in a jurisdiction where you're licensed to practice medicine. If you're flying over Arkansas, you need to be licensed in Arkansas to practice medicine in Arkansas. But more importantly, you're being thrown into a situation that creates a doctor-patient relationship in which you cannot control the factors, and that is spooky. And so you need to be in control when this happens. So the analogy I like to use, and I want to ingrain in you, is the lab coat. Is my lab coat on, or is my lab coat off in this situation? And it's not so much, do I think it's on or off, is do other people think I'm wearing my lab coat or not? Am I acting as a doctor, or am I acting as Jeff or Karen or whatever your name is? And so you need to affirmatively let people know that you are not being a doctor. And so if someone rolls their ankle at rec league softball and you're the first one out there and you're doing a whole checkup, you've established a doctor-patient relationship, which means legally you have obligations now. You have obligations to follow up. You have obligations to take a chart note, and you don't get to bill them because they didn't agree to that. And so if you want to be that person, by all means, be that person. But be wary of it, because you don't want to create expectations in a situation you cannot control. And so that's my best advice for you, is that from the lawsuits I've been involved with, people have had their butts handed to them when they were doing nothing but what they thought was right. And what was right, helping that person out, was the right thing to do. But unless it's an emergency situation, I really think you need to kind of be oblivious to what's going on. And so watch those affirmative actions. The other part of this is the termination of this relationship. And again, this is really on you. When you terminate someone's care, you have to take certain steps. So if the treatment's been completed, the step you need to take is letting them know it's been completed. Someone comes in from a car wreck and they've got neck pain. You say, listen, this is cervicalgia. I really think you need to be treated twice a week. Let's do it for 6 weeks. We'll evaluate from there. They go through it. They attend all 12 appointments. At the last one, you say, how do you feel? I feel great. Then you let them know, okay, I think you're done. Or give them like, okay, well, if this happens again, let's schedule another appointment, let's say in a month, just to check in. And so you have these options, and whatever is kind of based on your reasonable, educated opinion is what you need to communicate. And that's the big word there, is you need to communicate this to your patient. And so if they're done treating, you need to let them know they're done treating. Or if they're done treating with you, you need to facilitate a transfer to another provider. And sometimes when a patient's done with you, if a client wants to fire me or fire you, I don't really want to deal with them anymore. However, we have obligations to make sure, either in my case, their case, in your case, their treatment is continued elsewhere. And so you need to find what's reasonable, saying, okay, I can provide you a name of other physicians, and you at least have to offer that. They don't have to accept it. All you have to do is offer it. And so as long as you've documented your steps, you're golden. And then there's abandonment. And that's when you just kind of, that's that you abandon the patient. You go on vacation and you're gone you go on a 6-week, safari, and you didn't tell your patients, you've abandoned them. You didn't, if you go on a 6-week vacation and you haven't put someone in place to treat your patients who are actively treating, you've abandoned them. And so you need to make arrangements. And that's kind of one of the drawbacks of our professions, is that we don't ever get to leave for anywhere without taking steps to make sure our business is still operating the way it needs to operate. You're business owners in a lot of cases. Even if you're working for someone else, you own that client's care. And so you need to take specific steps. And so no vacation can just be taken. You have to do some certain things along those lines. And so before I jump into informed consent real quick, I got to do this let's see. Participants. Okay, so let me hurry and jump through this. And so Herrera. I wish it was on alphabetical order up here. And I'm happy to take any questions right now as I go through this.
I have a question, Dr. or Mr. Woodward, Professor Woodward.
Thank you. Yeah, go ahead.
If you were in our situations and you wanted to avoid abandonment and go on like a 2 or 3 month vacation, how would you do it?
Well, someone married rich. And so in my case, when I do stuff like that, one is informing the patients, letting them know, hey, I'm gonna be gone. And then you have to go through each one of your patients and determine, okay, well, this person is supposed to treat with me twice a week for 6 weeks, and they still have 3 more weeks on their treatment. You have to make arrangements for them to get that treatment. And so you need to either hire someone to come in and temporarily fill in for you. There's services that handle that. Whoever's listed as Ben in the participants, can you give me your last name?
Sorry, it's to pass.
Gotcha. And so there's services that handle that, or you need to make arrangements with another doctor that will take them on for you, and you have to communicate. So you have to facilitate that. So you have to set up your patients with like their new boyfriend or girlfriend is what you're essentially doing. And so as long as you facilitate the opportunity to do that, and you've taken reasonable steps, then you've done it. You've fulfilled your obligation. And in some instances, you also have to make yourself available. So if you're going to be gone for a few months, reason may dictate or require that you keep your cell phone on, you keep your email monitored. So I have to monitor my email because the court may need something from me, because even when I'm on vacation, I have active cases. And so you may be required to remain in contact with certain patients. In the chiropractic standpoint, that's not really going to come up as much as, let's say, if you were a psychiatrist, right? But you need to look at every situation with kind of that lens of, am I going to be needed, and what will I be needed for? It is much easier to take attendance in classes where I have like 15 people.
Professor Woodward, I also had a question.
Yep, I'm going to do this better. I'm going to take screenshots of these names. I'm going to do this after. Yeah, go ahead.
So in the scenario that you listed, where let's say that you're at like a sporting event or a team event that you're a part of, it's just recreational, someone gets injured, do you think one of the better ways to approach that is to tell them like, hey, like come in tomorrow for an appointment, and trying to like push the doctor-patient relationship into the setting where you can best control it?
Yes.
Okay. And then, but by doing that and then saying like, yeah, I'm going to come in for an appointment tomorrow, do you still not recommend offering any medical advice or things that they can do in the interim?
Is if it's something beyond what, what's the acronym, RICE? If they've got a twisted ankle and you tell them, hey, you need to elevate this, keep your pressure on it. That's not really medical advice. That, my little league coach told me that. My little league coach was an idiot. Was not qualified to give medical advice. So if it's anything specific, and once again, are they seeing you as the doctor, or are they seeing you as just someone on the team that can handle a sprained ankle? So you just got to weigh the whole situation there. So it's highly dependent on on the situation. And so just kind of do what and we'll talk about this at the very end here. It's called the reasonable person standard. What would a reasonable person in this situation think? So would they think, oh, I'm being treated by a chiropractor? Okay, well, then that might raise it a little bit. Or is it, hey, I rolled my ankle, they're going to give me ice, and he's saying, or she's saying, hey, come in to my office tomorrow, we'll take a look at it. You're going to be fine in that situation. But the instinct you had right there was spot on, as saying, hey, let's stabilize the patient, and then say, hey, come see me in my office. Same thing with people ask me law questions all the freaking time. People from high school who didn't like me all of a sudden like me. Because, hey, I get a Facebook Messenger request saying, hey, remember me? How you doing? And then they're either selling me something from doTERRA, or they're telling me they're getting divorced and they need help, or they're starting a business. So, it's one of those, hey, sorry you're going through this. If you want to talk about this, here's the link to my appointment calendar. Sign up for a consultation. Also, it'll be $250. I hate to be that way. I used to give a lot more free consultations when I started out, but it's expensive being in our jobs. Our jobs cost money to be in, and so charge people. Good instinct though. So let's talk about informed consent here. We got about 10-20 minutes left. Did it say we end at 11:40 or 11:30?
We end at 11:30.
Okay, we got 10 minutes. So informed consent. Oh, I didn't.
We have 3 minutes.
Oh, you're right here. So I got off into it. So go ahead and look at these slides on your own. The quiz will be open and they'll be taken directly from this. But what I want you to really focus on is informed consent. And I'm going to hang out here afterwards if anyone has any additional questions. And what's required in informed consent. And then I got some hypotheticals in there that are kind of fun to play with. But other than that, just kind of look at the steps. What is required to make informed consent? And so, the example I said, I go to a doctor and they say, Mr. Woodward, you have a moderate case of what we call resting dumb face. I think the best course of action would be to slap you around for a few minutes. After that, I believe we would all feel a little better. And so you've provided me a diagnosis. You think I have resting dumb face. The plan of management, well, the treatment is to give you a good slap. And the prognosis is, hey, we're all going to be better for it. You've established informed consent in that case. You get that diagnosis, plan of management, and prognosis. There are the things you got to consider too, things like their capacity, their age. People under 18 are considered by the government to not be smart enough to know things. So remember, if they're under 18, you need additional consent beyond their own. But you need to understand things like explaining the associated risks. That you don't have to say every specific thing that could possibly go wrong. You might get hit by lightning, but that being said, you need to be able to explain reasonable things to them. So that's it for this week. Shoot any questions you have at me, email. Otherwise, we'll get better on topic next week and use these slides for the quiz. And I'll hang out here for questions.
Thank you.
Thank you, Your Royal Highness.
So I just wanted to double check
Nick.
because I might have missed it, but when do you usually open the quizzes? And like when do they take place?
Usually they start right as class starts, is when they open up.
Okay, so like quiz would be, is it every week then, or?
Yeah, there will be a quiz every week, except for the weeks we have exams.
Okay.
How do I unshare my screen here? Pause share. Can I do that?
I think so.
All right. how do we, let's see, Zoom view. Yeah, I really got to get better at Zoom.
I think there's also a way for future reference that you can just download the participant list and
Yeah,
then you don't have to sit there and check it.
I gotcha. Yeah, I just took screenshots in the end there. So
Yeah.
thank you for that.
Absolutely. Thank you.
Any questions for those remaining here?
Yeah, Dr. or Professor Woodward, I am going to be gone next week. I have, I'm shadowing a doctor. So is there anything I need to do to make that up, I guess?